Hi everybody, it's Lisa here from Holistic Health by Lisa Moan. Thank you for joining me for my regular Monday night Facebook Live. And tonight we're going to be talking about reflux. So we're going to be talking about reflux in babies and children, and some of the learnings you can take if you're an adult or if you know an adult with reflux as well. Some of the learnings probably won't work. So next week we're going to be talking about where are good sources of iron for children. I see lots of children who are deficient in iron, and if you're deficient in iron, your immunity will be poor. You could display inattentive or hyperactivity symptoms, and your growth could slow down as well if you're low in iron. So rather than reaching for supplements, it's always better to make changes to your child's diet. So next week we'll be talking about iron and food sources. So back to tonight and reflux. Two of my children had shockingly bad reflux, but they were happy chuckers, I was told at the time. So they would vomit copious amounts after every single feed. But they were fine. I was probably more unhappy because I had to wash my clothes and their clothes and loads of towels every time I fed them. With my third child, I had learnt so much about food and nutrition and kids' health by the time he came along. I was very lucky and I could nip his reflux in the bud very quickly. And so it just goes to show that you can make really simple changes and actually completely change. And if I had have known what I knew with my third child when I had my first child, my life would have been so much easier. And so back then when my eldest was a baby, it's not a lifetime ago, it's only 11 and a half years ago, so it's not a different generation, but there was a lot less children who were medicated for reflux then. I mean, there were some, but it certainly wasn't as frequent as it is today. And if you look, at the Australian Bureau of Statistics, the rate of prescriptions for Losec and those medications have skyrocketed in the last 10 years or so. And so you really have to wonder why that is. And it's probably a combination of factors, as everything usually is a combination of factors. But I think definitely one thing is that there's Facebook groups now, and 10 years ago Facebook had just come in, so you didn't really get that. Now you can talk to thousands and thousands of mums at the same time about the issues that you're having. That just didn't exist 11 years ago. So if you go onto a Facebook group and people are talking about reflux, you can very quickly sort of put those symptoms together with your symptoms, think, oh, my child might have reflux too. And so there is that sort of aspect of knowing more about these issues and talking to other mums with those issues. So I think that is definitely a factor. But another factor, which is absolutely true, is that our gut health is getting worse. So 100 years ago, there was no processed foods. We all ate very natural foods, very nutrient dense foods, and we didn't take medication. So our gut health was fantastic. But with every generation that goes past, our gut health is getting worse and worse and worse, which is why we're seeing so many chronic diseases and autoimmune diseases coming to the fore. Is because our gut health gets worse with every generation. So it does make sense, therefore, that kids today will have a lot worse reflux than kids 25 years ago. So that's true. And then the other factor is, doctors' consultations are 12 minutes. Medicare rebates haven't increased in years. So there is that pressure on doctors to get patients sorted as quickly as possible, which could lead to an increase in prescriptions. So those are three sort of big factors that might be playing a role. And no matter what the cause, if you think that your child has reflux, you are going to want to treat that. So I'll just run through what the side effects are for the medications, because that is the first sort of port of call for many people, is just to try the medication and see if it helps. So if you actually look at the manufacturer's patient information for Losec, you'll see that they actually list the side effects as constipation, nausea or vomiting, diarrhea, headache, skin rash, itchy skin, wind, stomach pain, dizziness, and a dry mouth. I don't know, but that seems a little bit crazy that the medication that you're giving your child for vomiting might actually cause them to vomit or feel sick. So, of course, not everybody will get those side effects, but they might, and that's why they list them, because you might get those side effects. And that's sort of the short-term side effects while your child's taking the medication, which incidentally, if your child does take the medication, it should be for a very short and discrete period. I've seen adults who have been taking this medication for 20 years, which is insane and certainly not what it was intended for. But if your child does take this medication on an ongoing basis, so more than say 3 weeks, then studies show that they have a higher risk of getting frequent gastro. Because the acid has been reduced in their tummies, it's that acid that keeps the bad bugs out. So if you reduce the acid, your child is going to get more gastroenteritis, so vomiting bugs, diarrhea bugs, anything that goes around daycare, they'll get it. They'll get more respiratory infections, more bone fractures because they're not absorbing their nutrients from their food because the stomach acid isn't high enough. So they'll have more chances of being the child at the trampoline park with the broken arm. And also low magnesium levels for the same reason that they're not absorbing it from their food. And if you listened to me last week talking about magnesium, and it's a really calming nutrient. So it's really important for sleep, for conditions like ADHD. It just really calms children and takes the edge off. So if they're on low sec, they're not absorbing their magnesium, they're going to be less calm. So all these factors that you really do need to consider. But I mean, I'm not anti-medication. I'm all about weighing up the cost and the benefits with your healthcare provider and deciding what's right for you. So some children and some adults will need low sec, but there's lots that won't. So you need to decide, do the risks, the long-term risks and the short-term side effects, does that make worth your while to take the medication, or should you look at other things first? So my theory is to always stay on the safe side and always try natural methods first before you go for the medications. So with babies, whenever you're feeding them, first thing you want to do is whenever you've fed them, you keep them upright for 20 minutes. And that just lets the milk all settle down into their tummy. Because the problem is with babies is that their lower esophageal sphincter, which is about here, isn't very strong. And that's why the milk can come up and down a bit, which is actually normal for it to come up and down a bit. That's not necessarily a bad thing. But if you leave them upright for 20 minutes, it gives a chance for that milk to kind of settle down in the stomach and it won't come up as easily. So have a little snuggle with baby on your shoulder before you put them down to bed or to change their nappy or to play. And so when you do go to change their nappy, you can actually prop them up on the change table. So again, that they're not lying completely flat, which lets the milk come back up. So prop them up on some towels or a cushion or something for when you change their nappy. And you can actually, because the nappies can be quite tight on them in some positions, which squeezes everything back up, it can get messy, but you can take their nappy off for feeding times and just wrap them loosely in a towel or something like that. Because sometimes when you feed your baby, they want to do a poo at the same time. So they're kind of trying to push the poo, but then they push the milk back up instead. So it just makes it a little bit more comfortable on their tummy if they don't have a nappy on. So just kind of have nappy free time with lots of towels when they're being fed. And don't tickle and excite your baby again after they've been fed. So no, especially daddies can come along and take the baby and start to tickle them. So don't do anything like that. Just very calmly hold them upright for 20 minutes or so. And then in their cot, if they're prone to vomiting once they actually go into their cot, you can adjust their mattress and put a little, you don't really get phone books anymore, but put something under the feet of the cot, or you can get special wedges to go into the cot. So again, they're not completely flat anymore. And try not to, you should feed your baby when it's hungry anyway, not on a schedule, but don't stretch your baby out so much between feeds that then they have to have a massive feed, because then that's a lot for their teeny tiny tummies to deal with. So do go for like more frequent small feeds rather than stretched out big feeds. And so that's kind of the practical things that you can do. So that's what I would actually do first before I even look at the diet, because making dietary changes, you really do need to work with somebody to do that, because you can end up cutting out a lot of very nutritious foods and losing weight way too quickly, because you don't want to dramatically lose weight or undernourish your own body when you're breastfeeding, because the priority is to make your breast milk as nutritious as possible for your growing baby. And if you cut out a million foods because you think that's what's causing the reflux, your milk could dry up, very, very quickly. And that is the absolute last thing that you want. So if you're going to try eliminating foods, I would definitely work with somebody and identify the foods that you want to cut out. So those would be things like wheat, dairy, soy, chocolate. Those would kind of be the main ones. So you would cut those out for a very specific length of time. So say 3 weeks. And if there's no change in that 3 weeks, you could try to remove other foods, or you could just reintroduce those foods again and try something different, because you really don't want to get onto that spiral of only having 2 or 3 safe foods. That's not great either for your mental health or for your baby's health. If your child's a bit bigger and they're already on solids but they still have reflux, then you want to cut down on their refined carbohydrates. So things like bread, pasta, all those foods, and that's something in adults as well, the first thing to do. Those are really problematic for reflux. So baby, child or adult with reflux, you cut out the refined carbohydrates and go for the more antioxidant rich foods. So instead of giving them pasta, give them sweet potato or pumpkin. Instead of white potato, again, give them vegetables instead. So really cut down on the fried foods too. And if your baby isn't actually breastfed but they're bottle fed, experiment with formulas. So goat's milk is readily available and it's a lot more gentle on babies' tummies. So if they have allergy to milk, then goats might not work. But if their tummies are just a little bit sensitive, then goats can be a really good option. And I like goat's milk anyway, because cow's milk is just so industrialized, whereas goat's milk is that step more traditional and can be a little bit more nourishing. So in terms of sort of homemade remedies that you can use, if your baby's breastfed, I wouldn't give them anything else into their mouth except breast milk, because their guts just aren't ready for it. But you can dose yourself and then it will come through the breast milk into your baby. So one thing to do is to make sauerkraut juice. So the instructions to do this are on my website, and you might think, oh my God, that's disgusting. But it's not bad. It's quite salty. It's okay. And that's really healing to your esophagus or to your baby's esophagus. So that's a great thing to try. And then you can also try things like chamomile tea, which again are very good for a baby's tummy. So you drink the chamomile tea and the baby gets the benefit through your breast milk. So that kind of has a few benefits. It's good for your guts, but also it's calming, because there's no doubt that the more stressed you get as a mum about the reflux, the worse the reflux will get. So you need to make sure that you're looking after yourself. So drinking chamomile tea is the tip of the iceberg, but other things you need to do is, make time for yourself, make sure that people in your life can take the baby off you, so you can go for a walk or go for a yoga class or go to the grocery shop on your own, whatever floats your boat. So try the sauerkraut juice, and if your baby is a bit older and they've already started solids, then they can have it, just squirt it into their mouth in a syringe, and you might think, yuck, that's disgusting for a baby, but I'm pretty sure that Losec doesn't taste that great either, or any other medications. And my kids ate sauerkraut in their high chair by the handful, and they loved it. So don't yuck their yum. Don't assume that it's a very adult taste and they're not going to like it. Give it a go, and it works wonders, and that works wonders for adults too. And then the last thing to try is probiotics, because obviously they have a really beneficial effect on gut health for mum and for bub. So there's specific strains of probiotics that are very useful for reflux, and I've got lots of good evidence for colic and for reflux. So try some probiotics and see if that helps. So of course, I'm always here to help. So you can pop some questions below, or if you are struggling with reflux or any other health issue, feel free to send me a message and we can arrange a time to talk, either on Skype or in person. And yeah, we can go from there and see how I can help you. Any questions, just pop them below. Otherwise, I'll see you next week, and we'll be talking about iron. So how to boost your child's iron stores by eating different foods, and the benefits that has are on behaviour, on sleep, on immunity, on energy, on growth. The list goes on. So thanks for listening, and I'll talk to you next week. Bye bye.